Kyla, what were your initial symptoms of MS?
The initial symptoms were numbness in my fingers and a little bit of numbness in my toes. And after things progressed a bit, I began to feel Lermite-sign. So when I'd bend my neck or come to a stop, I'd feel a little buzzing go down the back of my neck and down my spine, and in the beginning, down the front of my thighs as well. That subsided, and only occasionally do I have that, probably caused by one of the lesions in my cervical spine.
Did any of those sensory symptoms need treatment?
Well, initially, because it was the first attack on record, I probably had an attack a couple of years before with a small patch of numbness on my lower back. But I went to the doctor, and the doctor said, if it goes away, it goes away. If not, give me a call. It went away, so I didn't think of it for those 2 years. So other than the initial treatment with corticosteroids and being hospitalized, I was also treated with antibiotics at that time because they thought it might be Lyme disease. Other than that, no.
So you had the usual treatment for an acute relapse of intravenous steroids?
Yes.
But your symptoms itself didn't need treatment. But sometimes sensory symptoms are troublesome with burning, and they may respond to certain medications. Bonnie, what were your initial symptoms? Only symptoms, I
Only
guess.
symptoms. Transient tingling that started on the right side and traveled through my body to the left side. I did have 3 progressive sensations within a 5-day period, and that has been it.
But those also didn't need specific treatment?
No, they subsided once I sort of felt an electric current run around my body, and it was over after that.
So EJ, you mentioned that you were taking a symptomatic medicine for walking. Mm-hmm. How's that supposed to work? What does it do?
I think that it basically builds bridges over some of the scarring that causes the signal not to get through. So it allows me to walk. My brain can tell my leg to move for the first time, in many years.
What was your walking like before you started on dalfampridine?
I wasn't able to move my right leg, or it was really my right hip flexor, and I had foot drop. It was hard for me to lift my toes. So when I would walk with a cane, I'd have to turn my leg outside so I could kind of use my inner thigh muscles to pull my leg around. But it was, difficult to, even in my own apartment, to get to the bathroom. And so now, obviously, going to the bathroom is not something I have to think about and plan, which is just
so
fantastic.
That particular medicine's been a godsend for you.
It's been a godsend. I think they call me a super responder because it really has. I took pills for 4 days, and then all of a sudden I could move my leg again. But if I don't take the pills, my leg would stop working. So.
Yeah, that is a medicine that helps a lot of people, but unfortunately doesn't help everybody who has walking trouble. When you were having all the problems with your walking before we had dalfampridine to put you on, what other kinds of treatments did you get for your walking? Did you have physical therapy or anything like that?
I did physical therapy. I tried wearing a brace for a while. I also had a lot of pain in my legs and my lower extremities, which I still have pain. So some of the physical therapy was just to help with the pain. I had a lot of spasticity and tightness that was uncomfortable. So I did spend a lot of time trying different things. I actually started even doing Pilates almost therapeutically because I found it really helped stretch and keep my body moving, and I was able to lay down while doing it. So it was a really great exercise. But I did find, even at my worst point, that doing some sort of exercise, I actually bought a bike for a while to use with my arms because I couldn't move my legs. But just keeping my body moving seemed to really make a difference, both in my mind and body.
Were you ever put on any other medicines for either the pain or the spasticity?
Yeah, I tried a lot of medications, and I think it's a real challenge, and it's good to be able to work closely with a doctor to balance the side effects versus the effectiveness of the drug. A lot of the medications I tried specifically for spasticity made me so tired that I'd have to take a large enough dose that I was sleeping, so then it didn't really matter. And I'm still on different pain medications, but chronic pain is something that's very difficult to, I think, manage. And a lot of those drugs, as we know, are so addictive. So I actually see a specialist, a pain specialist, a neurologist that's helped me with that.
Pain is a very difficult management issue in MS, and one that years ago we didn't recognize was a part of MS. And now we know it's common, and there's a lot of different kinds of pain, and they may or may not respond, but the approaches need to be different depending on the kind of pain. Some people will get burning pains, which sometimes respond to medicines like gabapentin or pregabalin or duloxetine. Some people get jabs of pain that respond to drugs that we usually use as anti-seizure medicines, even though these are not seizures that people are experiencing. And then there's sometimes pains that are related to secondary orthopedic changes, relating sometimes to abnormalities of gait. And those might respond to typical analgesics, pain relievers, either over-the-counter ones or prescription ones, including narcotics for some patients. So.
And I actually, what finally worked for me was a combination of two of those, because I definitely have more nerve pain, which is kind of like terrible pins and needles. And then I also have kind of pressure pain, which I think is from the fact that I walk differently. So taking two different types of pain medication tended to be what was most effective for me.
And spasticity is another symptom that's very common in MS and is something that very often we can help with. You mentioned one of the mainstays of treating spasticity, which is getting on a good stretching regimen, which usually is sort of organized by the physiotherapist. And there are medicines. You didn't have a positive experience, I gather, with some of the anti-spasticity medicines, but other people will do quite a bit better and be able to tolerate them. They do seem to have drowsiness as a component, and that's quite variable from person to person. Some people can tolerate high doses of these medicines and not get very drowsy. One of the medicines we commonly use for spasticity is called Baclofen. Were you ever on that?
Made me very tired.
Yeah. And one of the problems with Baclofen when you take it as pills is that much of it gets into the brain, which is not where you need it, because the spasticity is coming from the spinal cord usually. And sometimes in people who have bad spasticity, we can actually put in a pump that delivers the Baclofen directly to the lower spinal cord, which is where the problems are much more likely to be coming from. And then you give very, very low doses of Baclofen, and it doesn't cause the side effects of drowsiness or dizziness or whatever.